One of the biggest shifts in concussion care over the last several years is how we think about exercise. For a long time, patients were told to rest until their symptoms went away. And while rest still matters early on, we now know that prolonged rest is usually not the best answer. In fact, when used correctly, light aerobic exercise can be one of the most helpful tools we have for concussion recovery. But the key phrase is when used correctly. Because exercise after concussion is not about pushing through symptoms, returning to sport too soon, or testing toughness. It's about using the right intensity at the right time with the right progression. So let's break this down in a practical way. In the first 24 to 48 hours after concussion, the goal is relative rest. That does not mean complete bed rest. Patients can still get up, move around the house, complete basic daily activities, eat meals, take short walks as tolerated, and avoid being completely isolated in a dark room. But this is usually not the time for formal exercise, hard workouts, conditioning, or return to play training. After the first couple of days, we typically want to begin introducing light aerobic activity. This could be walking, stationary bike, or another simple activity where the patient's heart rate increases slightly. But they could still easily carry on or hold a conversation. That conversational pace is a really helpful way to explain it to patients. If they are gasping, struggling, or feeling like they are training hard, they're probably doing too much. A common recommendation is around 20 minutes of light aerobic exercise per day, as long as symptoms remain controlled, as this is where symptom monitoring becomes important. I usually explain it this way. A mild symptom increase is not automatically dangerous. If symptoms increase by about 1 to 2 points on a 10-point scale, that may be acceptable. But if symptoms increase more than that, or if symptoms do not return back to baseline within about an hour after exercise, then the intensity was probably too high. That gives patients a simple rule. Exercise should challenge the system lightly, not flare it up dramatically. Now, clinically, one of the reasons exercise matters is that concussion can affect autonomic regulation. Some patients develop exertional intolerance, where symptoms increase when heart rate rises. This can show up as headache, dizziness, lightheadedness, light sensitivity, noise sensitivity, fatigue, or just feeling like the brain and body are not regulating well. That is why exertion testing can be so valuable. Once the patient is out of that initial 24 to 48 hour window, completing a structured exertion test with a trained healthcare professional can help identify whether the patient has an exertion tolerance and help guide the correct heart rate zone for recovery. This is much better than guessing, because some patients are underdosing activity because they are afraid to move. Others are overdosing activity because they feel okay at rest and assume they are ready to train. The right answer is usually somewhere in the middle. We want enough activity to promote recovery, but not so much that we overload the system. Aerobic exercise may help create a better recovery environment by supporting blood flow regulation, improving sleep quality, regulating mood and anxiety, and promoting neuroplasticity. And that is why I think this is such an important clinical message. Exercise is not just fitness after concussion, it is part of rehabilitation. So here are the practical takeaways. First, encourage relative rest for the first 24 to 48 hours. Second, after the first couple of days, begin light aerobic activity if tolerated. Third, keep intensity low enough that the patient could carry on a conversation. Fourth, monitor symptoms carefully and keep and keep increases mild and short-lived. Fifth, use exertion testing when appropriate so you can prescribe exercise more precisely instead of relying on guesswork. The bottom line is this: exercise after concussion should not be feared, but it should be guided. When we dose it correctly, aerobic exercise can become one of the most practical and powerful tools in the concussion rehab process. If you want a practical resource you can use with patients right away, download the light aerobic exercise after a concussion handout. A link is in the description below. And if you want a deeper clinical framework for concussion evaluation, exertion testing, vestibular and ocular rehab, cervical considerations, and return to activity planning, check out our comprehensive concussion rehabilitation and evaluation course. This is through Concussion Spot Education. See the link for that also in the description below. We'll see you in the next video.